Broadcast is now starting. All attendees are in listen-only mode.
Well, hello everyone, and welcome to our webinar this evening. The title is Blood Sugar Boot Camp. So thank you very much for joining us. Should you have any technical difficulties during the webinar this evening, there is a number to call at the bottom of your screen. It's Citrix Support, and the number is 1-800-263-6317. So we look forward to an interactive program this evening. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the question section of the webinar toolbar. At the end, you'll have a chance to ask questions, and so we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Educator will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice. It involves the professional opinion of the Cecilia Health Certified Diabetes Educators. Our webinar leader this evening is Andrea Castleberry. Andrea is a registered nurse and certified diabetes educator who has coached with Cecilia Health for several years. She received her Bachelor's of Science in Nursing from Baylor University and is preparing to begin her Doctor of Nursing practice at Baylor University. She's passionate about spending time educating with her patients so that they can live their lives to the fullest. And in her spare time, Andrea enjoys spending time at the lake with her husband and 2 sons and 2 Australian shepherds. So thank you so much, Andrea, for being with us this evening, and you may take it away.
Well, thank you, Katie, for the warm welcome. I'm glad to be here with everyone tonight and look forward to the next hour or so that we're going to spend together. So getting started here, our agenda this evening will include, or our discussion will include, a discussion about self-monitoring blood glucose values. So we'll talk about why you should check your blood glucose or blood sugar, and I'll use those two terms interchangeably. We'll talk about when you should check and how to check. We'll talk about how to keep a glucose log and why that's important. We'll also discuss target ranges and how to manage high and low blood glucose values. We'll talk about Dawn phenomenon, ketoacidosis, and checking for ketones, as well as what is an A1C and what is estimated average glucose levels. We'll also have, like Katie mentioned at the end, a time for questions and answers and for sharing. And as Katie mentioned, please just talk with your healthcare provider before making any changes to your treatment plan. So getting started, let's talk about the benefits of checking your glucose levels. So checking your glucose level throughout the day gives you a good picture of your body's response to your diabetes care plan. And as you know, I'm sure you've discussed with your healthcare provider, keeping your glucose level in the target range can help to prevent or delay complications of diabetes. Glucose levels naturally rise and fall throughout the day, even in someone who does not have diabetes. So it's great to check throughout the day to get a good sense of what your blood sugar is doing throughout the day. Also, it's really important to monitor your glucose level on a regular basis if you're taking insulin or other medications that may affect your glucose levels. If you're having a hard time controlling your glucose levels. Also really important to check if you have low blood sugars without the normal warning signs of a low blood sugar. Or if you have ketones from high blood sugar levels, then that is a time where you'd need to check more frequently. Also, talking about checking your glucose level, there's a lot of things that can affect your blood sugar level. Some things that might raise or increase your blood sugar level. Physical inactivity, so the quote unquote couch potato, definitely not being active can lead to higher blood sugar levels. But at the same time, some types of physical exercise can also increase your glucose level as well. Stress has a profound effect on blood sugar levels. So the more stress in your life, usually the more cortisol your body makes, cortisol is a hormone that your body makes, and cortisol can increase your blood sugar level. If you're sick, again, sickness affects our hormone levels and can cause insulin resistance, causing our blood sugar levels to rise during that time of sickness. And even, even a week or so after we feel better, our blood sugar still might be elevated. A meal that's higher in carbohydrates will cause your blood sugar to rise. And then, of course, not enough diabetes medication or forgetting to take your diabetes medication. Some things that might lower your blood sugar levels. If you accidentally miss a meal or a snack, if you're really busy at work and you skip lunch, then it could be that your blood sugar level might, you might have a low blood sugar or just might run lower the rest of the day. If you don't eat enough carbs at your meals, so if your doctor and dietitian or diabetes educator have recommended that you eat a certain amount of carbs at a meal and you don't eat that amount of carbs, then your blood sugar level could be lower. Alcohol intake, this one's kind of surprising, but alcohol intake, especially on an empty stomach, can cause your blood sugar level to run lower. And that has to do with how your body processes the alcohol and what's going on in your liver. So how and when should you check your blood sugar? So let's talk about the how first. Many of you may be completely comfortable in checking your blood sugar levels, or some of you may have never done it before. But typically, you can get a glucose meter from your doctor. A lot of times they have samples, or you can get a prescription for one that you can take to your pharmacy. You can also just buy them directly from the pharmacy. You should always wash your hands before checking your blood sugar. It is best practice to wash your hands with soap and water before checking your glucose level, although I understand that sometimes, that's not feasible and you have to use like an alcohol pad to clean your finger off. If you do use an alcohol pad to clean your finger off instead of washing your hands with soap and water, I would recommend waiting until the alcohol is completely dry before pricking your finger with the Lancet device. I do not recommend using a alcohol gel, like a hand sanitizer gel, to clean your hands. Some of those gels actually are, very fruity smelling and actually might have sugar added in them and can affect the reading of your glucose level. So again, best practice, wash your hands with soap and water if you can, and then if that is not feasible, then use alcohol and let it dry. And then typically, to turn on any glucose meter, you insert the test strip and the device will turn on. And then you wait for the meter to tell you to apply a drop of blood. You want to use the lancing device on the side of your fingertip. You want to try to avoid the middle pad of your fingertip, just typically because that's more sensitive than over a little bit on the side. And then touch and hold the drop of blood to the area on the strip according to the directions where it sucks up the blood. So most of these strips have like a siphoning effect and will just take a very small drop of blood and siphon the blood up into the strip. And then after a small countdown, usually about 5 seconds, your glucose level will appear on the meter's display. And we'll talk about this in a little bit, but whatever number appears on the display, I just want you to think about that number not as good or bad, but just information that tells you what's been going on and lets you know what you need to do next. So when should you check your glucose level? The fasting glucose level is the one that is done before breakfast. This is typical for most people with diabetes that their physician would like them to check their fasting glucose level in the morning. And then also it's, recommended a lot of times to check your glucose level before each meal. So that's typically 3 times a day. Usually that fasting glucose level is the one before breakfast. And then sometimes even 2 hours after the start of a meal. And then also one that's really important, especially for people who take medicine or insulin injections or wear an insulin pump to manage their diabetes, is to check before bedtime. This is really important to make sure that your blood sugar level is in a good range before going to sleep. So obviously there's a lot of different times that you can check listed there. Definitely check with your healthcare provider as to when and how often they want you checking. Depending on your diabetes treatment plan, the medicines that you're on, and your goals, they might recommend more or less often. So keeping a glucose log. Back, several years ago, we had to keep paper glucose logs, which weren't always the most convenient to carry around that piece of paper with you. And now with the addition of smartphones and different devices, keeping a glucose log is a lot easier than it used to be. What is important to record on a glucose log, no matter if you're using a paper glucose log or one that is based on an application on your phone, it's important to record the date and the time. Also the glucose level result. And then any notes that you think might be important, such as if you were more active that day or if you were very stressed. If you were sick, anything that you think might be, contributing to your numbers at that time. Any feelings that you had, if you felt tired or shaky, if your blood sugar level is low and you feel shaky, that's important to write out to the side. So those are things that are important to record. There's some apps listed there on the screen that are great ways to keep track of your glucose level. And then here on the screen here, you can see different pictures of what those apps look like. Sorry, I'm gonna go back one. Also, there are some meters that are Bluetooth that can actually send your glucose level to an app on your phone. So if you're interested in one of those, talk to your doctor about which meters can do that. I know a lot of times the glucose meter that you use is driven by your insurance provider. They may cover one test strip that works with a certain meter and not cover any other. So that's another factor to consider. All right. So when you check your glucose level and you get a number, what does that number mean? So let's talk about the target ranges and what those look like. The American Diabetes Association has some standardized targets. Now, keep in mind that your doctor may recommend these targets, or they may recommend different targets just depending on different factors. So the targets recommended by the American Diabetes Association before a meal, which is called preprandial, your glucose level should be in the range of 70 to 130. Now, again, these are targets for people with diabetes. 2 hours after starting a meal, which is called postprandial glucose levels, your glucose level, the goal is to have your glucose level to have fallen to at least less than 180 milligrams per deciliter 2 hours after the meal. So anytime someone eats, whether or not they have diabetes, blood sugar is going to go up. And a person with diabetes, typically the blood sugar rises more than someone without diabetes. But what's important is that it comes back down into a good range 2 hours after a meal, and that target is less than 180, okay? And then a hemoglobin A1C target of less than 7%. So a hemoglobin A1C is an average glucose level, and we'll talk about this more in a minute, but an average glucose level for about a 90-day period. And that average glucose level takes into consideration or averages the glucose level 24 hours a day for that 90-day period. So we're talking about all blood sugars before meals, after meals, during meals, during the day, in the middle of the night, all times of day, and it averages them together. So what 7% equates to is an estimated average glucose level of about 154 milligrams per deciliter. Okay, so you're taking into consideration in that 154 both the preprandial or before meal glucose levels combined with the postprandial, and then again, everything in between, overnight, all times of day. So again, this can be individualized based upon how long you've had diabetes, your age, any other medical conditions that you may have. If you have known cardiovascular disease or different complications such as microvascular conditions related to diabetes, your provider may want a little bit lower target levels. If you have what's called hypoglycemia unawareness, meaning that you have low blood sugars without knowing about them, without the normal signs and symptoms of low blood sugars, your doctor may set a slightly higher target for you because low blood sugars can be dangerous, especially if you're not aware that you're having them. And then any other individual considerations that you may have, just speak with your doctor and make sure that you know your target ranges. Okay. So moving on, let's talk about low blood sugar or hypoglycemia and high blood sugar or hyperglycemia. So low blood sugar, hypoglycemia, is typically defined as anything less than 70 milligrams per deciliter. So that's when you check your blood sugar, that's a reading of 70. So some things that can cause low blood sugar again are too much insulin or too much diabetes medications or not enough food. If you don't eat all the carbohydrates at your meal and you've taken your medicine for those carbohydrates, or taking more insulin than was recommended or needed. Exercise can sometimes cause low blood sugars either at the time of exercise or even what's called delayed low blood sugars from exercise. So maybe you go on an hour-long walk and then later on that evening you have a low blood sugar, so you can have delayed low blood sugars from exercise. So there's a few symptoms of low blood sugar listed here. Those can include shakiness, dizziness, sweating, rapid heartbeat, weakness, hunger, fatigue, just a feeling of confusion or irritability can also be included. There's actually a list of like, I don't know, maybe 10 or 15 different symptoms that you can have with low blood sugar. If you've never had a low blood sugar before, and I hope that you never do, but it's kind of something that goes along with diabetes. And so when you have a low blood sugar, typically you'll have maybe 2 or 3 of these low blood sugar symptoms. Whatever 2 or 3 you have, those are probably going to be your low blood sugar symptoms going forward. So what do you do when your blood sugar is low? Well, when your blood sugar is low, it makes you feel pretty awful. And so you want to get your blood sugar back up to a normal level just as quickly as you can. And the way to do that is to treat a low blood sugar with what's called the rule of 15. So what the rule of 15 is eating or drinking 15 grams of rapid acting carbohydrates, waiting 15 minutes, and then rechecking your glucose level again. Okay, so it is very important that those carbohydrates that you take to treat a low blood sugar be rapid acting. So what is considered a rapid-acting carbohydrate? A rapid-acting carbohydrate is something that contains only carbohydrates that are absorbed very quickly. So it doesn't have any fat or protein or fiber in it that's going to slow down the digestion of those carbohydrates. So some good examples of what would be considered, or what is 15 grams of rapid-acting carbohydrates, is about 4 ounces of any fruit juice, about 6 ounces of any regular soda. There are glucose tablets that you can buy over the counter at the pharmacy. They usually come in a tube, and each tube has a bunch of different tablets in it, and each tablet usually contains about 4 grams of rapid-acting carbohydrates. So to get enough, you'd have to eat about 4 of those. There's also glucose gel. So this is a packet that contains gel that you just swallow. And that packet will contain 15 grams of rapid-acting carbohydrates. Also, a fun-sized pack of Skittles is about 15 grams of rapid-acting carbohydrates, and also 2 packages of Smarties is 15 grams. So those are some good choices. You could also get 15 grams of carbohydrates, say from a granola bar or from eating almonds, but those things contain other items in them that are made up of fat and protein. And so while they will raise your blood sugar level, they won't raise it quickly, which is what we want to do when your blood sugar is low. We want to get feeling better just as quickly as we can, because low blood sugars make us feel really bad. Okay, so you eat your treatment for a low blood sugar, and then you should wait 15 minutes because it takes time for those carbohydrates to absorb. You should recheck your blood sugar. And at that time, if your blood sugar is still less than 70, which is not common, but if it still is, then go ahead and treat that low blood sugar again. Wait 15 minutes and recheck. It is important, especially if it's going to be a long time until your next meal, to follow that low blood sugar treatment with a small snack that does contain some fat or protein, something to kind of stabilize your blood sugar and to keep you from getting low again. Okay. So let's talk now about high blood sugar, which is also called hyperglycemia. So high blood sugar can be caused by not enough insulin, or the insulin that you gave not working properly, or the insulin in your body that your body makes not working properly. Some causes of high blood sugar can be stress, illness, eating maybe more carbohydrates than you thought at a meal, and also not enough exercise. So some symptoms of high blood sugar can include increased urination and thirst. Also, some symptoms of high blood sugar can be hunger and fatigue. And if you notice, hunger and fatigue in particular can be symptoms of both low blood sugar and high blood sugar. So because some of the symptoms for low blood sugar and high blood sugar are the same, it's really important to check your blood sugar when you feel like something might not be right, because you can't always go just based upon how you feel. You wouldn't want to feel hungry and assume that that's because you're having a low blood sugar and eat something, when maybe you were feeling hungry because your blood sugar was high, and then you've just made it go up even more because it was already high and now you've eaten something. So it's really important to check when you don't feel right. If you think you feel low and you check and you're not low, then no big deal. It's just an extra check. Okay, so how do you treat a high blood sugar? So this is where it's really important to log your blood sugars, as well as low blood sugar is really important to log as well, because repeated high blood sugars, especially at a certain time of day, can give us insight into what's going on with your diabetes treatment plan, with your medications. It can indicate a need for a change in the treatment plan, in medications, in diet. And so that can be both for low blood sugar and high blood sugar. Hydration, drinking water when your blood sugar is high helps your body flush out that extra sugar through urination. So always a great idea if your blood sugar is high to drink extra water, as long as drinking extra water is not contraindicated or not recommended by your physician for other health issues. So some people with heart conditions, drinking extra water would not be a good choice. So if you have questions about that, definitely talk to your doctor. Again, physical activity can sometimes, while it can cause a low blood sugar, it can also cause a high blood sugar, certain types of physical activity. Okay, so something that can come from long periods of high blood sugars is called ketoacidosis. So ketoacidosis occurs when the body does not have enough insulin. As you probably know, insulin helps our bodies use glucose for fuel. So when you eat carbohydrates, your body breaks down carbohydrates into glucose. And as you probably know, glucose levels, the glucose is in your bloodstream. And so insulin then helps your body get glucose from the bloodstream into the cells where it's used for energy. So what happens when the body does not have enough insulin is the body starts to break down fat for energy because it can't use the glucose for energy. It can't get it into the cells without the insulin. So when the body breaks down fat for energy, it creates these waste products from the breakdown of fat called ketones. And the body tries to get rid of ketones through urine. Now, why does the body try to get rid of ketones? The body tries to get rid of ketones because they are acidic, and our body's like a very small range of pH levels. They don't like to be too acidic or too alkaline. And so if those ketones start building up, that can really be toxic in the bloodstream. And so the body tries to get rid of these ketones through urination. So someone who is in ketoacidosis might be urinating frequently. They might also start breathing very heavily to try to get rid of some of the ketones through our lungs. Okay. I see that there is a hand raised from one of the participants, and we'll get to questions at the end. So if you do just want to jot your question down real quick, then we'll come back to questions at the very end. So let's talk about how to check for ketones. So you should check for ketones anytime your glucose level is more than 300. Some symptoms of ketoacidosis are nausea, vomiting, severe abdominal pain. So if you have any of those symptoms, that's a good time to check for ketones. If you're sick, you should check for ketones even if your glucose level is normal. So you can have a cold or a flu and have normal blood sugar levels, but still have ketones. Typically with ketoacidosis, you do have high blood sugars, but like I said, you can have normal glucose levels and ketones, even if normal glucose levels and ketones, even if your glucose, when you're sick, sorry about that. If you feel tired all the time, that is also a symptom of ketoacidosis. If you're thirsty or have a very dry mouth, if the skin is flushed for no other reason, if you're having a hard time breathing, a fruity smelling breath is also a symptom of ketoacidosis, or feeling confused or in a fog. So those are all symptoms of ketoacidosis, and those would be a good time to check for ketones. So let's talk about dawn phenomenon. Dawn phenomenon is a rise in the blood sugar level overnight. All people have dawn phenomenon, whether they have diabetes or not. So there's a surge of hormones that happens in your body. The body produces hormones, and daily usually around 4 to 5 a.m., the body starts releasing those hormones. And these hormones are necessary just to your body, and some of these hormones even help you wake up in the morning. So people with diabetes don't have the normal insulin response to adjust for this. And so in turn, you may see your fasting blood sugar level or your blood sugar level first thing in the morning go up. And you may be wondering, hey, I went to bed with a great glucose level and I woke up and my blood sugar level's high. How does that happen if I'm not eating anything in the middle of the night? So if you're seeing that, again, this is why it's important to keep a glucose log to notice those patterns. Some things that might help: if you eat dinner a little earlier in the evening and really pay attention to your carbohydrates with dinner, that can help. If you maybe increase your activity after dinner, such as going for a walk, and then, of course, if your fasting glucose level continues to be high, then your healthcare provider may either prescribe or change your medication or your treatment plan. So a little bit ago, we talked about hemoglobin A1C, or it's also commonly referred to just as A1C. So again, it gives a picture of your average glucose level or blood sugar control for the past 2 to 3 months. The estimated average glucose level, or hemoglobin A1C, represents an average of the glucose levels 24 hours a day over that 2 to 3 month period, including the times when you're not checking, okay? A family member of mine has type 2 diabetes, and she often tells me, we talk a lot, and she often tells me that she just doesn't check her blood sugar level when she knows that it's going to be high, and because she doesn't want to have to write that number down in her log. And we laugh about that, but she knows that even though she's not checking it at that time, that number, that glucose level, is still being quote unquote recorded in her hemoglobin A1C. So while self-monitoring blood glucose level, or those daily or multiple times a day finger pricks, check your glucose level at that one moment in time, the A1C is a representation of your glucose level over time. So the results of this give you a good idea of how well your diabetes treatment plan is working, and may also, recognize the need for any changes that might need to happen in your glucose or in your diabetes treatment plan. So your single checks don't give the same big picture like we talked about. But it does help to confirm your test results, your self-checks with the doctor. And it really helps give you feedback. Both self-monitoring and your A1C gives you feedback on how healthy choices can make a difference in your diabetes control. Okay, so you've probably gone to the doctor's office and seen a chart similar to this. So again, the American Diabetes Association, their recommended average glucose level, or A1C, is 7%. So again, that equates to an average of 154. And you can see as you go up even just to 8%, that raises the average glucose level over that 3-month period to 183. Okay, so we are going to move on to our question and answer time. I really want this to be an interactive webinar, so please don't hesitate to ask questions. I know someone raised their hand earlier. Please don't hesitate to ask questions. I'd love to discuss. And then also, if you'd like to share a diabetes management tip that has worked well for you, we'd love to discuss that as well. So over on the right-hand side, you should have a toolbar. And if you go down a little bit in the middle of the toolbar, you should see an area where it says questions, and that's where you can type in your questions. So I'll give everyone just a moment to type in their questions, and then I'll start going through those. Okay, great. We've got the first question that's come in here. So the first question is, why does it matter how high my glucose level goes after a meal if it returns to a normal level before the next meal? That is a great question. So if you think about the recommendations in the postprandial glucose levels, being that it should fall to at least less than 180 2 hours after a meal. If you think about those 2 hours, if you eat 3 meals a day, every day, that's 6 hours of every day that's considered postprandial glucose levels. So that's 25% of your average glucose level every day. And over time, that's a big percentage of your A1C levels. So while the fasting glucose is looked at a lot, the postprandial glucose, especially the closer you get to your A1C goal, can play even more of a factor into reaching that goal. So if you're having a hard time reaching your A1C goal, but your fasting glucose level is in range most of the time, that might be something to look at. What's your blood sugar doing after meals? And so that might mean, adding a check-in a couple times a day after a meal. So if you have questions about that, talk to your doctor about when and how often you should be checking, but that's a great question. Okay, we've got another question here. The next question is, what is a continuous glucose monitor? So you may have seen advertised on TV several different CGMs, or continuous glucose monitors. A continuous glucose monitor is a device that is worn on your body. So it's worn externally. However, it has a portion of the device that's actually under the skin, and it's not a permanent device, but rather it's usually worn for about 7 to 14 days, depending on the manufacturer, and then it's taken off and replaced by the user. Typically a pretty easy procedure to insert what's called the sensor on your own. Most people just do that on their own at home. And a continuous glucose monitor reads the glucose level in your in the fluid right under your skin, or your interstitial glucose level. And so it gives you a new reading every 5 minutes. And so this can be really beneficial to help to get feedback as to how certain foods affect your blood sugar levels, how certain activities affect your blood sugar levels, how stress, how all of the different factors that can cause your blood sugar to rise or fall and affect your glucose levels. And it can give great feedback in the moment, which can really in turn help to optimize glucose control. Continuous glucose monitor is not, not for everyone. So if you're interested, if you think you might be interested, if you're having a hard time fitting finger stick glucose level, checking into your schedule, or if you're having low blood sugars that you don't recognize, or just having a hard time reaching your A1C goal, maybe discuss with your physician if that is something that would be a good option for you. And most insurance companies do cover CGM monitoring in some fashion. So there's several different makers out there, and most insurance companies cover one or more of those devices. So great question there. All right, and give a few more minutes for other questions. All right, we've got another question here. This question is, if my blood sugar is low right before a meal, what do I do? That is a great question. So if it's time to eat lunch or dinner or even breakfast, if it's just time to eat a meal and you check your glucose level and your glucose level is less than 70, should you treat that low blood sugar or should you just go ahead and eat your meal? So remember, the thing with low blood sugars is we want to get them back into normal range as quickly as possible. And we do that by treating with rapid acting carbohydrates. So the best thing to do when your blood sugar is low is to treat with the 15 grams of rapid acting carbohydrates. Wait 15 minutes, recheck your blood sugar, and then eat your meal. And if you take insulin, it is really important that your blood sugar level has come back up to at least above 70 before taking your insulin. I've had some patients in the past say, well, why don't I just go ahead and eat my meal and then give my insulin later? And while I see how that makes sense theoretically, again, that meal has fat and protein in it that's going to delay the absorption of the carbohydrates, so the blood sugar is not going to come up right away. So it really could be a dangerous situation where the blood sugar stays low for an extended period of time. So safest, best thing to do is to treat with the 15 grams of rapid acting carbohydrates and wait to eat your meal and give any medication or take any medication until your blood sugar is back up to a normal level. Really good question there. All right, I see that one of our participants has their hand raised, and if you have a question, if you could please just type it in the question box, I'd be happy to answer it. If you have a comment that you would like to share, if you could please just type that in, that you'd like to share something that's worked for you, please. All right, well, I think we're going to move on from the question and answer time here. So just moving through a couple more things I wanted to cover. We have some upcoming live events with Cecilia Health. The next month, our topic is A Happy Heart is a Healthy Heart, and I am going to be teaching that webinar as well. So that'll be really informative. And I'm looking forward to that one. And then in October, we have Diabetes 101, Mastering the Essentials. So if you'd like to sign up for either one of those webinars, just let your Cecilia Health Diabetes Coach know, and then we can get you signed up. So again, if you want to attend more events, just ask your coach and they can keep you informed as to what's coming up and get you signed up. If you haven't signed up for text messages for us and you'd like for us to communicate to you that way, let us know, ask your coach, and we'll be happy to do that. And then if you're on Facebook, if you would like some great diabetes information and tips, just like us on Facebook, Cecilia Health Personalized Diabetes Coaching, and you can find us at the link there. Thanks so much for joining us today. I really appreciate your attendance and the active participation that we had today. I loved all of the questions. And again, my name is Andrea Castleberry, and I am a certified diabetes educator and registered nurse with Cecilia Health. Thank you.